So I think that actually every small healthcare business has an opportunity to tell a pretty good story around big data and use it for sales and marketing purposes. I think people tend to think about big data in terms of huge data sets, things like Hadoop. The reality in healthcare is today the largest source of digital healthcare data is within the EHR system, and that's typically clinical visits, episodic data, recordings in person between a provider and a patient or a consumer. But so many small healthcare companies are building solutions that are more patient-centered or patient-facing. So they're building systems for bundled payments or patient portals or for telemedicine, care management, all sorts of different solutions that are meant to deliver data and some type of service directly to the patient. And in doing so, what they're creating is an entirely new data set that doesn't exist in healthcare today. And all of those different pieces of data from patients interacting with those telemedicine solutions or those bundled payment solutions or care management solutions generate a really powerful set of dimensions on individuals or dimensions on those specific patients. And those dimensions, when combined with more traditional digital healthcare data within the EHR, actually enable health systems to do more in terms of big data analytics, in terms of targeted interventions, and just sort of generally having a better understanding of how their patients' health is. So, what types of things they're searching for, when they're taking their medications, how many steps, when they're scheduling appointments. All of those different pieces really should inform the big data strategy that the health systems that are buying those solutions ultimately build. So I do think that really small healthcare businesses have a unique opportunity to expand and augment the healthcare data that systems already have, and by expanding and augmenting that data, enable them to have a much more effective big data strategy and ultimately deliver more proactive care and care that's targeted to be high value and not really high volume.